So the burden of management of disease and management of a patient's health is on both the doctors and the patients and all the professionals who are involved in it. Before leaving my office after the last talk saying bye, the patient turns around and say, "What about the kidneys, doc? Do I have kidney stone?" Machine don't diagnose. There is no button in the machine that you press and it will say kidney stones or certain kind of cancer or certain kind of mass. It is the approach. It is. Viewers, today I am starting this new series of talks to talk about some common myths and beliefs and confusions in among patients about different kind of ailments and issues. And believe me, I am compelled to do that because this is getting out of hand. Myths in the third world. One of the myths is, okay, every back pain or flank pain or lower abdominal pain is kidney stone. People even don't go to the doctors, they go to the pharmacy first and ask them, hey, can I get a stone crusher? And they start doing their own treatment. So why do we do that, and what are the consequences of it? We'll talk about it a little bit, in brief points to clear things up. First of all, what is the reason of overdiagnosis of nephrolithiasis, as it is called in medical terminology, and kidney stones in layman language, especially in the third world, like the Guyana and other countries. The first and foremost reason is the unavailability of skilled professionals and also machines like ultrasound, CT scan, proper lab, because these tools help us to see stones, kidney stones clearly, and help us to diagnose if somebody has kidney stones. The other reason for this is that the professionals who are dealing with the patients are probably not properly trained. When the machines are there, labs are there, but the professional training is not to that standard that they can find the stones in the kidney, or the reason for pain or some blood coming in their urine. In most of these third world countries, the clinicians don't put their knowledge towards differential diagnosis to think about what other things can cause the symptom, which very easily can be blamed to kidney stones, and diagnosed very easily as kidney stones. Most of the doctors have their knowledge from textbooks, and textbooks usually say flank pain, you look for kidney stone, and then the buck stops there, and you don't think anything else, and you say, this person might have kidney stone. In Guyana also, where we live, this belief, this cultural belief, I would say cultural, because I go through a lot of patients every week, and sometimes it really bothers me, or frustrates me, that I come to find things which are very serious. Sometimes they're life threatening, and I do the required tests, required clinical examination, and then come to a diagnosis and trying to tell the patient what the patient has and how urgent it is to take care of that problem. And before leaving my office after the last talk saying bye, the patient turns around and say, "What about the kidneys, doc? Do I have kidney stones?" I just look at the patient. And patients are not, sometimes they are not at fault because somewhere somebody has told them that, okay, this pain is from kidney stone. One has to be very careful when you're labeling somebody that they are having kidney stone because it not only gives a psychological stress to the patient but also to the family, and the family thinks that the kidney stone is something, a big monster, which is there, and it is limiting the function of their family member. The most important thing is that labeling somebody or believing that somebody has kidney stones without any proof, without any investigation, without any help from the tools I mentioned, that ultrasound, CT without contrast, or urine test to see blood cells in it. Sometimes this whole thing delays the actual diagnosis. People could be suffering from some serious things, serious diseases, malignancies, cancers. The symptoms could be due to ectopic pregnancy, which means that pregnancy in the tube or at a abnormal place within the uterus sometimes. And if it ruptures, it could threaten the life, and the person could die before reaching the hospital. Appendix can rupture, right? And also there might be an abscess or a hematoma or some muscular sprain or other things within the body, which sometimes people get their discs in the back, between the vertebra there is a spongy disc which prolapse, herniates, and it could make them really disabled. They can't work if it increases in intensity and severity and go to an advanced stage. And the outcome of this misdiagnosis is sometimes very grave, very serious. It will actually put a financial burden on the patient also. Like, some places, people are asked to come back again and again and again to give the same stone crushers, as they call. Most of us clinicians don't believe in those herbal stone crushers because they facilitate, no doubt. They act like diuretics. They facilitate passage of tiny little one, calcium deposits. But the big stones, if they're obstructing the kidney, they can't help it. And if some big stones are obstructing the flow of urine from the kidney into the bladder, it could have adverse effects on the function of the kidney, and sometimes the kidney stops functioning. So people have to be very careful when they uh, get these pains and the pain is not going, but they keep going. They lose faith in the doctor or the medics or the any medical professional who is treating them. Financial burden is there also, right? But then one more thing which I want to emphasize, and it goes to my physician colleagues and the other people like medics, nurses in the rural health situation, that if there are situations or conditions which you cannot handle, please refer them to the specialist. For example, kidney stone. If the kidney stones are there, for example, and are causing blockage of urine and the kidneys are affected, the patient's BUN and creatinine, which are markers for the kidney function, are elevated, for example, send the patient to the specialist in that subject, a nephrologist, urologist. For example, an old person who cannot pee properly, and don't keep giving them pills to help them or pass catheters. And sometimes I see those catheters, indwelling catheters for a long time, people carrying the bag with them. Refer them to urologists. neurologists are the people who will take care of them. Similarly, if you notice some problem with heart, refer the person to cardiologist. Don't just keep the patient just to satisfy the patient that you are taking care of them. Sometimes it is wise to refer them rather than keeping them to yourself. This goes for every system. We have neurologists here, we have ophthalmologists here, we have cardiologists, orthopedic surgeons. If somebody has a problem with their joints and bones and things like that, just don't keep on giving them the medications which are harmful for their kidneys in long run. Send them to the specialist who specializes in them. So the burden of management of disease and management of a patient's health is on both the doctors and the patients and all the professionals who are involved in it. You can, patients I'm talking to now, you can't just go to the pharmacy and say, hey, I'm suffering with this, give me. A person on the other side of the counter who has studied maybe high school or maybe college, even if somebody is, a little more educated, but not enough to diagnose a condition or give the required treatment and investigation, it is dangerous. We have to understand that for every condition, every situation which involves our body and its function, we have to seek, the help of a physician or a trained medical staff. If your car is not working, you take the car to mechanic, not to a carpenter, right? Same thing. Body is more expensive than car. Life is more important. You see, I am a sonologist and physician. I have spent years of my life in treating patients with the help of ultrasound. A lot of times what my eyes can see, others might not see. I'm not bragging about myself. I'm just mentioning that even if ultrasound is used, CT is used, especially ultrasound, machines don't diagnose. It's the experience, it's the eyes, it's the skill which counts, with which you see things. People who are like board certified, educated in that subject, and have spent their lives looking at the things would recognize, would identify problems and causes and diseases more better than somebody who was put behind a machine. Machine don't diagnose. There is no button in the machine that you press and it will say kidney stones or certain kind of cancer or certain kind of mass. It is the approach. It is the way a person deals with the machine, deals with the different knobs and tools and things on the machine, and the color Dopplers on the machine, the surface imaging from the machine using different kind of probes, different kind of frequencies, which make the person diagnose diseases and situations which are complicated. A lot of times I get these patients who have been to other places and different stores, I call them, people buying machine, putting somebody behind it, which can diagnose correctly, and big things are missed. So we need to emphasize on the training of health professionals also, whether they're technicians, whether they are nurses, paramedics, doctors. Being a doctor does not mean that you're good in ultrasound diagnosis or radiological imaging expert. It is different for different specialties, right? So I would also want to educate patients that when they go somewhere, they should ask the background of a person, whether they specialize in their fields or not, whether they can see things uh, because of their experience and because of their training better than others. They can ask questions. One thing which I noticed in Guyana and all third world countries, that people are afraid of asking questions. I must tell you, to the patients, you have every right to ask questions to your doctors or whoever is dealing with your body. It is your body they're dealing with, right? You can also, if you get tested somewhere, you have a right to ask them for the report, copy of the report. Keep a copy of the report in a folder at your home. So when you see some doctor, some other doctor, or second opinion, or third opinion, you should have those reports with you, right? A lot of times I hear, oh, doc, I went to the hospital, but they didn't give me the report. That is your right. If you pay for a test, you have to receive the report. You have to get the report. Maybe a lot of my colleagues would be mad at me why I'm asking people to do that, but I hope they understand. We have to educate patients as well. We have to tell them what is the right thing to do, because all these things, as physicians, patients, healthcare professionals, the other professionals, we all make a healthy society. And healthy societies don't hide things, they're more transparent, they're more open to educate their subjects, their patients, their clients, rather than hiding things from them. So these are my 2 cents for today. I hope people will benefit from it. So please get out of the myths and get into reality. This is Dr. Ghazi.